Welcome to today's session. In today's session in mental health, we are looking at institutionalization. So we'll go straight to look at how we can define institutionalization. So institutionalization refers to a process by which individuals become dependent on and adapted to living within an institution such as a mental facility after prolonged hospitalization. So in simple terms, when we talk about institutionalization, it simply means that this particular individual feels more comfortable living in a mental facility rather than being discharged. And they have become used to living in this mental facility such that they don't see themselves leaving the mental facility or becoming independent and staying on their own outside the mental facility. And when the patient reaches that state, then we know to say that the patient has become institutionalized. And that is what this definition means. We have a number of risk factors or causes that may result in institutionalization. The first one is long-term hospitalization. So patients who have stayed in the mental facility for a long period of time, they'll become accustomed or structured to the routines that happens in the hospital. They are accustomed to the constant supervision and support. So over time, they will lose that confidence that they have in themselves in terms of decision making and managing their own life. And so at the end of the day, what we end up seeing in them is becoming institutionalized, because that ability of them making their own decision will no longer be there. Apart from that, the other risk factor is lack of guardian and family. Some individuals feel comfortable or may not want to be discharged from the mental facility because there is lack of guardians or families, such that even if they were discharged today, they don't have anyone they are going to outside the hospital, and hence they will feel comfortable. So hence we see that individuals may prefer to stay in the hospital where they feel safe and protected, because there's no family out there that can protect them. Apart from that, other risk factors includes loss of independence. So mostly in institutions, these individuals will have their needs met. For example, meals, medication, hygiene, all this is managed by the staff. So there's that reduced opportunity to make decisions or independent choices in individuals in a mental facility, such that at the end of the day they become dependent, because that is how the system is structured. Other risk factors includes strict routines and rules. So in mental facilities, there is usually fixed schedules and rules that control every activity at each and every particular time. Now, these are patients who are being admitted for a long period of time, such that over time, these patients will become accustomed to being told what to do and when to do it. So all that reduces independence in an individual, and they may become comfortable and wanting to stay in a mental facility because everything is being done for them. Domestic violence as well is another risk factor, because individuals or patients who are abused at home, they may prefer staying in the hospital rather than being released back into the same individuals that causes harm to them. Other risk factors is overprotective care. And in overprotective care, we see that sometimes nurses and caregivers, they may do too much for the patient, such that they prevent the patient from learning or practicing self-care or decision-making skills, because we are trying to apply ourselves. But in trying to apply ourselves, we do not allow the patients to do basic things or certain things for themselves. So at the end of the day, we end up creating an environment where patients, everything is being done for them, and we end up looking like we are the servants for them. So these mental patients will want to just continue staying in a mental facility because things are done for them. Lack of rehabilitation programs as well. When there is no rehabilitation programs like occupational therapy, social skill training, community reintegration programs, all these will not promote, if they are not there, it will not promote the patient's interest in wanting to be reintegrated back into society, because the things are being done for them. And that is about the risk factors that we see in institutionalization. Amongst the clinical features or symptoms or signs that may indicate that the patient is becoming institutionalized, it includes dependence on the institution, where this particular patient becomes a highly dependent on the structures and routines of the institution. In short, they rely on the staff for everything to be done for them. They do not show interest in doing things for themselves whatsoever. That is the earliest sign or clinical feature of institutionalization. Other clinical features is loss of independence. The patient loses the ability just to make simple choices and act independently, such that even simple tasks like choosing what to wear or when to eat or what to eat becomes difficult without guiding them. All that indicates loss of independence, which shows that the patient is becoming institutionalized. Social withdrawal. The patient avoids interaction with other individuals. They prefer to stay alone, and apart from that, they don't even want to form any relationship. Even in the same hospital, the ward, they don't want to call anyone as my friend. That shows social withdrawal, which is a symptom of institutionalization, because they know that there's someone who will do everything for them. And if they don't have that social connection in the hospital, they will not have social connection of wanting to go back into society. Apart from that, loss of motivation. A patient who's not motivated simply means that they are not willing to do anything for themselves. You are motivated to do school because you want to do things for yourself. You don't want to be dependent on someone. But when someone does not have that motivation to do anything for themselves, that shows that they are willing to have someone do everything for them, and they are not interested in learning on doing things for themselves. Decreased decision making abilities, where a person struggles to make decisions when they are even discharged, or they are used to others. They are used to others because others decide for them, and they are always scared of making mistakes. So those are signs that indicate that the patient is having decreased ability to make decisions, and they are becoming institutionalized. Other signs or clinical features that we may see is passive behavior. The patient is always quiet, obedient, and they are always inactive. Instead of taking initiative, they wait for instruction from the staff. So that is passive behavior. Difficulties adapting to community life. The patient, because they have stayed long period of time in the mental facility, they may struggle just to adjust to the life outside the institution. And tasks like finding a job or managing money can become very difficult to such individuals. So these are the clinical features or signs that may indicate institutionalization. Amongst others, of course, is emotional dependence. We see other preventive measures that we can put in place. So these preventive measures can be applied if we are trying to prevent institutionalization, specifically in a mental facility. Among us preventive measures, the first one is early discharge and community care. When we discharge patients as soon as their condition stabilizes, this will make sure that the patient does not get used to the treatment that they are receiving in the hospital to end up looking like this is a hotel. So the patient, because they are not staying longer in a mental facility, it makes them have interest to go back to the community. Hence, early discharge and community care is one of the preventive measures of institutionalization. Apart from that, rehabilitation programs can prevent institutionalization. When we integrate rehabilitation and occupational therapy programs, it will help the patient regain the daily life skills, confidence, and also independence. And all this will help the patient to live independently and be able to return back to the community. Others are, of course, encouraging independence are preventive measures where nurses and caregivers can encourage patients to make their own decision, performing simple tasks like dressing, cleaning, and managing money. All these are simple tasks that you can see and allow the patient to make their own decisions that will end up promoting independence, preventing institutionalization. Others are family involvement. When families are involved in the patient's care plan, for example, you increase or you promote regular visits from the family, counseling, family education, all this will promote the bond and also make sure that the family are always in contact with the patient, making the patient wanting to go back to the family, which is back into the community. Rather than where there is no family involvement, this patient will not feel the need to be discharged. Apart from that, also community-based mental health services can prevent institutionalization. For example, you establish daycare centers, halfway homes or houses, outpatient clinics. This is where the patient can receive treatment whilst they are living at home. And like this, because they are always in touch with people at home or in the community, they will not become accustomed to normalizing staying in the mental facility. Other preventive measures is recreation and social activities, because in recreation and social activities, interaction with others is always there and it is always promoted. So the patient will not feel lonely or wanting to be alone, because they will always feel the need to talk and interact with others, because as human beings, we are mentally okay when we have friends or when we socialize. That is why in mental health, we are always talking about socializing, because without this aspect, we are not mentally okay. This is why we go into relationships. This is the reason why we marry. It is because we are fulfilling something that is mentally innate in us. Apart from that, we can look at psychiatric conditions that may result in institutionalization. There are certain common psychiatric conditions. When a patient has it, it's easy for them to develop institutionalization. And these psychiatric conditions include schizophrenia. And the reason is because in schizophrenia, there's loss of touch with reality. And patients with schizophrenia find it difficult just to function independently. And that is why we see that schizophrenia increases the risk of institutionalization. Others are bipolar mood disorders, because of the extreme mood swings that is seen in shifting between mania and depression. The patient may have repeated admissions in the hospital because they're having frequent episodes of either manic or depressive disorder in bipolar mood disorders. So frequent admissions may even make the patient wanting to even just be staying at the hospital, because they are tired of being discharged and readmitted every now and then. Apart from that, major depressive disorder or chronic depression, patients with such depression may experience loss of motivation, poor self-care, and suicidal thoughts. Hence, they may be subjected to long-term hospitalization just for safety and stabilization. At the end of the day, what may happen, what may be seen is dependence on nurses and also structured routines. So they may end up easily developing institutionalization. Other condition is dementia, because of the progressive memory loss, confusion, and impaired judgment that is seen. So such patient easily become institutionalized because they will never be able to do activities independently on their own. Other conditions is, of course, chronic anxiety. When a patient has chronic anxiety, it could be severe anxiety itself, or phobias, because phobias are a form of anxiety. Panic disorders is a severe level or fourth level of anxiety. All these may make the patient find it difficult to face daily life activities outside the controlled environment. Hence, if kept too long in the hospital, it may make them become institutionalized, because they will become dependent on what is being done for them. Apart from that, apart from those risk factors, others include substance-induced psychotic disorders, or someone who has a psychotic problem because of either alcohol, cannabis, or cocaine use, and other psychotropic drugs can easily become institutionalized because they will have prolonged admission or hospitalization just for them to undergo the process of detoxification. So at the end of the day, they may become too comfortable in staying in a mental facility. The other is, of course, intellectual disability. An individual or a child with profound intellectual disability, or where the IQ is below 20, such individuals will require 24/7 supervision for the rest of their lives. Hence, they may not even be willing to be discharged whatsoever because of their condition, first of all, and also they become comfortable because things are being done for them. Hence, they will not even have any efforts whatsoever to even learn basic activities that they can do for themselves, in as much as they have intellectual disability. Others, it is OCD, and OCD, because of the repetitive thoughts and rituals, they always interfere with normal life in an individual, and the patient may become institutionalized for a long period of time just to manage these behaviors. So at the end of the day, this takes away their independent behaviors. Moving on to the rehabilitation programs that can be used in a patient who is institutionalized. So these are some of the rehabilitation programs that you can talk about. The first one is group therapy. Group therapy will help the patient to share their experiences, emotions, and also coping skills just with others. And others will also be able to tell them how they are coping up and getting used to the problem that they have. So this will help promote a sense of belonging and just reduce that sense of isolation, so that they still feel the need to remain important in the community. Other rehabilitation program interventions, it's family therapy. The family has to be involved. Both the patient and the family members should be involved, because the family should understand the condition of the patient. You need to improve communication between the patient and the family. They need to learn how to offer emotional and practical support to the patient. Like this, it helps reintegrate the patient back into the family, so that the patient does not feel isolated and not feel the need to go back to the family. Occupational therapy, this one will help the patient develop daily living and practical skills like cooking, cleaning, also just practical use of money. All these are interventions that promote independence and confidence in the patient. Hence, this reduces institutionalization. Social rehabilitation, this teaches the patient how to interact appropriately with others in society. So like this, you are preparing the patient back on sending them back to the community. But without this aspect, the patient will not feel any need whatsoever to go back into the community. Vocational rehabilitation can be done so that the patient is prepared for employment or productive work. The patient should be made in such a way that they feel the need to go and work and earn a living. Because when they feel that way, they will not be accustomed to receiving free food and routines in the hospital. They will feel the need to become independent and earn a living through work. Hence, vocational rehabilitation is encouraged to reduce institutionalization. Other interventions, it is educational rehabilitation, where you focus on helping the patient resume or continue their education. It may include simple things like just literacy program, tutoring, or special classes, just to rebuild the concentration and learning ability. So if the patient has ability to progress in school, at least practice education rehabilitation, so that the patient feel the need to complete education, because this promotes independence and just give that sense of belonging in the community and just a self sense of importance within the community. Others is we can use halfway homes in the rehabilitation program. Halfway homes are transitional living facilities. It is like the way a home is, but it is not their usual home. This is a place for rehabilitation which is structured like the way a house should be. There is some independence in this house. So the patient is discharged from a mental facility into this house where they can do things independently. Of course, they have someone who is an adult supervising them, but they are allowed to perform independent activities. Can the patient learn that they can sweep when they see the house is dirty? Can the patient learn that I can cook when I feel hungry? So this is not a usual home, but it is a halfway home. Like that, you're teaching the patient independence, at the same time monitoring how well they can be reintegrated back into the family. Others are cognitive therapy, and cognitive therapy will help change the negative thought patterns, because the patient may have negative thoughts about going back or being discharged, and cognitive therapy will help remove those and promote self-esteem, and also just help the patient adjust to life outside the hospital. Others are individual therapy, and commonly we use psychotherapy as an individual therapy to the patient. And in this individual therapy, the patient can be able to express their thoughts and emotions privately. So the therapist can use whatever the issues the patient is facing specifically to the patient, and help them navigate through all those problems, and help the patient be reintegrated back into society. Other therapies, it is social support. Social support can be used where you try to build a strong support system from friends, families, and just the community, so that the patient does not feel lonely, and this will reduce relapse, because when they go back to the community, they always have people that they have within the community supporting them and encouraging them. So social support will reduce institutionalization in that particular aspect. Recreational therapy can be done where you involve the patient in sports, games, art, music. All this will help the patient become relaxed, express emotions, and just improve coordination. And this encourages teamwork and just brings joy in daily activities. So the patient will feel the importance of having people, or playing with people, or just interacting with people as you do recreational activities or therapy. Other interventions, it includes medication management, where you properly use prescribed drugs under the supervision, so that you reduce symptoms like anxiety, hallucinations, mood swings. This will allow the patient to function better and participate in rehabilitation activities. The last one among others is counseling, that can still be used in the rehabilitation process, because the patient will be able to understand their condition, set goals, and make healthy lifestyle choices. And by doing so, it gives emotional support to the patient during that transition period, and the patient will feel supported and helped and feel the need to go back to society. So basically, these are the key areas that you can focus on as you read about institutionalization, or as you try to understand more about institutionalization, so that the patient do not become dependent on the hospital or on the mental facility. But the patient should not see you as a nurse, as a helper. The patient should see you as a medical personnel, and they should not feel the need to be cared for throughout their entire life, because when they reach that state, it is difficult to take them out of that state, because they are seeing you and I as a servant and not as a medical personnel. They have become comfortable in their life, and they will never be willing to get better so that they are discharged. Sometimes they will even fake when they have felt better, but they will continue faking the symptoms because they don't want to go back home. So that is about institutionalization. Till next time, goodbye for now in mental health.